starting with an update, talk about the situation of vaccination and also our borders and how are we preparing for Christmas and what is the outlook for, and then also end up with some proposed mandates, which I'll give further explanation to. Of course, there's also going to be an in-country brisk activities. People are going to move to Accra, do shop and go and sell. People are trying to round up everything and travel, and so the activities in-country, and then this virus is spread by movement, and so the more you move, the more you interact, the more it gets transmitted. So the Ministry of Health and Ghana Health Service will continue to implement these protocols at the airport and other places. We also have to have strict enforcement on the protocols at the airport, as I mentioned. We have been a significant decline in cases over the past 2 months, but as we keep saying, we have been here before. A few new cases are on admission. We have increased number of cases among the international travelers over the past 2 weeks, and I'll go further, delve into that further. Increased availability of vaccines, especially in the last 4 weeks, we've received a significant number of vaccinations. And one of the worrying issues is that adherence to protocol is still very, very low across the country. What's our current situation as far as the numbers are concerned? We have a totally confirmed cases of 131,082. We've done about 1.98 million tests so far since the beginning of the pandemic. About 129 of the 131 have recovered. We are reporting total death of about 1,220, with a current active case of 22, severe cases of active case of 713, severe cases 22, and currently we do not have anybody in a critical situation in our facilities. I think this is just the usual epic curve. You can see that we go up and then we finish the third wave and we're still down. But we should not fool ourselves thinking that we are out of the woods. We've seen it go up again. Obviously, it goes to the 7-day moving average, which has significantly declined under the current situation. And of course, the active cases are also very, very down. So what is happening at the Kotoka International Airport and probably other ports? We have done a total test of 629,831, and we have recorded 33,093 positives with a positivity rate of 0.48%. There has been a surge of cases mostly among Ghanians who participated in internationals and international religious conference, but broadly there has been a marginal increase in the numbers in November. So the cases we have recorded in November 2021 is compared to 2020 is higher, and the next chart shows you that. If you look at the cases, you can see that in November this year, at the end of the month, we have recorded 168 positive at the airport. In 2020 November, we already 21, we have reached 205, and the month we still have some 2 days or 3 days to go. So that is a significant signal that we cannot take for granted. So that's the situation at the airport, and also mimics what is happening outside. You can see that there's surges in Europe and some parts of the world, and so the airport test continues to pick these signals, and I think it's something we must take a serious warning for us to see that these are times we need to be more careful. What we keep saying is that the fact that some of the people who may have come in may have been incubating, and that is a clear fact, so we need to ensure that we remain more alert. I want us to have some short chats on the vaccination, which is the most critical intervention we are currently doing. So far, as you are aware, we have about 5 vaccines registered in the country: AstraZeneca, Moderna, Pfizer, Sputnik V, and Johnson & Johnson. How many have we received so far? Since the beginning of the pandemic, we have received about 12,327 doses of vaccines of various types. AstraZeneca accounting for about 45% of all received, Johnson & Johnson 19%, Moderna 10%, Pfizer 24%, and Sputnik V 0.2%. So that is what vaccines we have currently in stock. But in the last 4 weeks, we have received a significant number of vaccines. That the chart shows. You can see the numbers that has come in. But in the last 4 weeks, we had a significant number of inflows of vaccines. That's why you see that our stock level is still high because they have just arrived. But what's the pipeline? The pipeline also assures us of more than 7.4 million doses that are supposed to come in between now and probably December. And we may even get more than what is. This is what we know, but we also get others that come in over time. And that will take us about 20 million doses of vaccines that we have received in the country before the end of the year. What is left is for us to take it. But why should we take vaccination serious? I'm sure we have listened to international data, TV reports about the importance of vaccination, but also in Ghana. We did some tests. If you look at the vaccination status at the KIA, despite the low percentage of COVID-19 among international arrivals in Ghana, positivity rate at KIA is 0.6 compared to 6.6% of tests, and there are still significant differences in the percentage based on the vaccination status. Among all those who are vaccinated for COVID-19 was 0.42%. The unvaccinated passengers was positive for 1.27%. When you compare the two groups, what it means is that person who is not vaccinated is 3 times more likely to be positive than the one who is vaccinated. And so that tells you that even for those who are being tested at the airport, the significant number are the unvaccinated who are testing positive, are the unvaccinated and not the vaccinated. Additionally, information from Ghana Infectious Disease Center also shows that among the severe and critical cases administered to the Ghana Infectious Disease Centers, nearly 98% were unvaccinated. That is those who were admitted, who were seen. But the persons who were unvaccinated were 30 times more likely to have a severe or critical case compared to the unvaccinated cases, which means that of the people who got positive and were admitted, 97% were unvaccinated. Among the COVID-19 deaths in the Ghana infectious disease, in a particular month where we had 16 deaths, 2 amounting to about 12.5% were vaccinated. But these 2 people had severe underlying medical conditions. That still tells you that the fact that you may be infected, but the fact that you get hospitalization and die is higher if you are unvaccinated. The rest of the 86%, as we said, were not vaccinated. But as unvaccinated is 7 times more likely to die from COVID than the person who is vaccinated. And that's why vaccination is extremely important. How have we deployed our vaccines? We have a target of 20 million, as was said by the president, by the end of the year, and we're still working very hard towards that. At least we have the vaccines to do that. 20 million of the, excluding the children 16 and below, but now that we have updated it, we are going to 15 years and above. Our vision is to vaccinate the entire population, including the children and the pregnant women, as more safety data becomes available. That's why we started with 18 and above But when safety data became possible that we can go, for Pfizer can go even up to 12, we have moved it down to 15 so that we can reach more of them. Our strategy remains the same. One is to static, that is where facility by facility, almost all our facilities are providing vaccination. We are doing outreach, we are going around from place to place to take the vaccine to the people. We are doing mobile vaccination. People will go to the lorry parks and see a car park, they're doing vaccination. We are doing camp out. There are some places, if you go to Kwame Danso area and the overbanks, you can't go and come the same day. So the team go there, set up a camp in these places, riverine areas, and stay there and vaccinate people, and a combination of them. Currently, what we have been doing is, you can see that we are taking the vaccines to the people. We are doing schools, going to schools to vaccinate, universities, etc. We are going to workplaces. I remember we went to Avians recently and vaccinated almost 600 of them. We are going to churches and mosques. As we speak now, there are vaccination centers in churches today. We are going to lorry parks and markets to vaccinate people, sports stadia, Takrady, among places where they are camping out, vaccinating before you enter, and when they leave, those who want to vaccinate are given, and house to house when it comes. I know that for some of the areas in Accra, they are doing house to house. In our villages, they are doing house to house to ensure that more people are vaccinated. So in all, we have done about 5.41 million people have been vaccinated. Like I said, we have the vaccines that we've had in the last 4 weeks, and so we're going to ramp up the vaccination. And if you look at the next slide, you can see that the real daily vaccination numbers are soaring. We reached about 142,000 doses a day, and that is